Hi, I'm Sunir Garg. I'm a retina specialist here at Wills Eye Hospital. And I'd like to speak with you today about diabetic eye disease. Diabetic eye disease is one of the most common causes of vision loss in working age adults. And one of the tricky things about diabetic eye disease is a lot of times patients don't realize they have it until it's pretty far along in their process. Because of that, we have pretty strict screening criteria, and every patient with diabetic eye disease should see their ophthalmologist for a dilated eye exam at least once a year. And if people have more significant findings, we may see them in a bit more frequently. Diabetes affects small blood vessels throughout the body. That's in people's fingers, their toes, their hearts, their kidneys, and in the back of the eye called the retina. And if we think of blood vessels like pipes, diabetes weakens blood vessels and causes them to leak. Blood vessels carry blood and plasma, so when you get leakage of blood and plasma on the retina, or in the center part of the retina called the macula, it can cause water damage. It's sort of like if I have pipes upstairs that start to drip on my ceiling tiles. Over time, my ceiling tiles become wet, warped, yellow, discolored, and start to fall apart. That same thing can happen to the eye. We call that diabetic edema. Over time, those blood vessels become so damaged that they don't bring enough oxygen and nutrients to the retina. Obviously, without oxygen and nutrients, no part of the body can do its job, and in the eye's case, that's to see. And without enough oxygen and nutrients, some of the retinal cells start to die off. In response to that, occasionally the eye will say, let me try to replace those damaged blood vessels by making new blood vessels. And it seems like that would be a good idea, but sort of like if you hire a bad plumber, those pipes might not be very strong and they can bust open, fill the eye with blood. They can also create a lot of scar tissue on the eye. Fortunately, we can do a lot of things to help folks. When they have those leaky blood vessels at the center part of the vision, there's two main treatments that we have, one of which is a laser, and you can think of it like a spot weld. If I have a pipe with a few leaky spots, I could take a spot weld and hit those. A laser does that. But for most of our patients, the leak is either more diffuse or affects the center part of the vision. So for those people, we have these amazing medicines, which are sort of like a sealant that seal up those leaky blood vessels. Those treatments need to be repeated periodically in the office, but people do really well with them. For folks who have the abnormal blood vessel growth, those same two treatments can be really helpful, not only in stopping further vision loss, but also in recovering vision. And there's some surgeries that we can do to help our patients with more advanced diabetic eye disease. The most important things that you guys can do is to see your ophthalmologist regularly and control your sugar and your blood pressure as best you can. And if you have any vision symptoms, of course, give us a call. I'm Sunir Garg from Wills Eye Hospital. Thank you.